My name is Dr. Lori Brotto. I'm based in Vancouver at the University of British Columbia. I'm a registered psychologist by training, and broadly speaking, my interest is in women's sexual health and more specifically women who have sexual difficulties.
Great. So if you have any recent research that's new, exciting, interesting, you could talk about that.
Okay. In my lab, we investigate multiple different lines of research relevant to the topic of women's sexual health and dysfunction. But one of the things that I've been especially interested in is using mindfulness-based interventions as a potential treatment for women who have sexual problems. And for those of you who don't know, mindfulness has a very long history in Eastern practice, in Buddhist meditation, and it's essentially the practice of present moment, non-judgmental awareness. And struck by many of the stories that I've heard from women with sexual problems who would say that during sex they feel disconnected. Their mind is somewhere and their body is somewhere else. You know, they might be thinking about what they want to make for dinner, they might be counting ceiling cracks, they might be thinking about how this is going to end in disaster, et cetera, et cetera. About 10 years ago, I thought about applying mindfulness meditation, which I was learning about for a completely different population, to women with sexual problems. So the process sort of unfolded with a bit of experimentation, a bit of pilot testing, and over the last 10 years we've developed a number of treatment manuals and have been able to carry out a number of randomized controlled trials looking at the effects of mindfulness intervention. So one of the more recent studies we've finished has looked at women who were seeking treatment for loss of desire and arousal and put them through a mindfulness intervention. And in addition to having them fill out self-report questionnaires, we also brought them into the lab and measured both their genital sexual response and their subjective sexual response when they were watching erotic films. And really interestingly and somewhat unexpectedly, we found that after the mindfulness intervention, the amount of agreement or concordance between genital and self-report or subjective sexual arousal significantly increased after the mindfulness intervention. And so that's really fascinating because, number one, concordance between genital and subjective arousal in women is in general quite low. And number two, that we found a method of improving concordance. And number three, it tells us a little bit about maybe the mechanisms by which mindfulness works. So we did some sort of time-lagged analyses and found that mindfulness directly impacted women's subjective arousal, and that then drove the relationship between their subjective and the genital arousal, as opposed to the opposite. So mindfulness didn't directly impact genital arousal, it directly impacted subjective arousal. So that's kind of cool because it gives more evidence that mindfulness works. And number two, it suggests that there's this new endpoint, this new way of measuring effects of treatment for women.